Welcome everyone, and thank you for joining. Today we're focusing on the Wessex Global Stroke Partnerships and the collaborative work behind the new core skills e-learning modules. We are joined by colleagues from the UK team and by clinical partners from Ghana and Zambia who have been central to developing and testing these modules. They will introduce themselves in more detail shortly. But over the next 20 minutes, we'll briefly outline the aims of the partnerships, the transition they went through from face-to-face training to e-learning, and then hear directly from our partners about their experience, the impact on stroke care, and hopes for the future. Enjoy this interview, and Sarah, over to you.
Thanks, Laura. So Lucy, I'd like to start off with asking you, what is the Wessex Global Stroke Partnerships and what are the aims of the partnership?
Thank you, Sarah. I'm Lucy Sykes. I'm a consultant stroke physician based in Hampshire in the UK, and I'm the UK co-lead for WGSP. We started in 2009. We're a group of UK-based stroke clinicians, predominantly in the south of the UK. And our partnership initially started at Korle-Bu Teaching Hospital in Accra in Ghana. We now have partners in Tamale and Ho in Ghana as well, and also in Lusaka in Zambia and Banjul in the Gambia. Our aim is to improve outcomes for people with stroke through provision of high-quality stroke care. And we do this through a focus on 8 clinical core skills, which have been collaboratively identified with training designed alongside partners. We are centred on hospitals with links to educational programmes for doctors, nurses and allied health professionals in order to try and have maximum reach within each country. Examples of core skills are swallowing, positioning, continence management, discharge planning and secondary prevention.
Great, thank you so much, Lucy. And can you tell us a little bit about how the partnership has been funded to date?
So all our funding has been through competitive grant application, and this has been predominantly via Global Health Partnerships, which was formerly known as THET. GHP is part of the UK Foreign and Commonwealth and Development Office, but we've also had some direct Commonwealth funding for visiting fellowships to the UK. So we were lucky enough to host a Ghanaian doctor and a Gambian nurse for 6 weeks earlier in 2025.
Great, thank you, Lucy. And you've told us a little bit, or given us an overview of the core skills that the modules cover. And could you tell us how these e-modules have been disseminated so far and where people can access the resources?
Much of the success of our partnership has been due to the focus that we've had on building personal relationships with our overseas colleagues. And this has enabled us to support them in their professional development, as well as advocating for service improvement and system change within their services. So during the course of the partnership, we've spent time visiting Ghana and the Gambia to deliver face-to-face teaching, as well as empowering local clinicians through a train the trainers model. Unfortunately, due to various funding constraints and also the pandemic, we have not been able to visit Zambia yet. But thanks to the power of the internet, we've actually been able to deliver an amazing project without ever having been in the same room together, which is testament to the folks on the ground in Lusaka. We've had 2 Global Health Partnership grants in the last 18 months, which has allowed us to convert the core skills training into online e-learning modules. And this has been working collaboratively with teams in Ghana and Zambia to ensure that they're fit for purpose. For example, the teams have helped us to sense check the content and language and ensuring that the modules work on a variety of devices, including mobile phones, and without the requirement for high bandwidth internet.
Now, over to our clinical partners, Julius, perhaps over to you. Would you like to tell us a little bit more about how you got involved with the Wessex Global Stroke Partnership?
Thank you very much. I am Julius, the lead nurse for the MDT, that is multidisciplinary stroke team. I got involved in this project through the lead physician for the project in Ho Teaching Hospital, that is Professor Awuku. He involved me and informed me about this project. I developed the interest, and I was sent to Kolebu Teaching Hospital to understudy their stroke unit. And this collaboration came through the support of Wessex Global. Thank you.
Excellent. Thank you for that overview. And Manango, perhaps you would like to tell us a little bit more about the development of the e-learning modules locally.
Thank you very much, Laura. So my name is Malango Goma. I'm one of the first ever certified stroke nurses here in Zambia, and I happen to be the in-charge for one of the stroke units that we have here. So I'm a nurse by profession, and how I also got to learn about Wessex Global Stroke Partnership, WGSPs in short. One of our head lead here at the University Teaching Hospital, Professor Diana Saylor, actually is that are result oriented. So she told us about this program with my partner, and that is how we learned about this. And also the aim also caught our attention because we were also brainstorming on how we can reach out to others, improving on the swallowing, the positioning, the incontinence awareness, as well as the discharge preparedness for our stroke patients. So that is how we were oriented, and we used to have the e-learning platforms where we were actually going through the modules step by step to know actually on how the Zambian setup is for our stroke units, and if we were supposed to change some other things from the existing Ghana modules that were there. And it was through that we had to go through the modules, and we had to administer the modules to the fellow, multidisciplinary team approach, where we had to administer the questionnaire to both, not only the nurses, also the doctors and physiotherapists, those who come in contact with our stroke patients. And that is how we got to know about the e-learning and also just the production of everything.
Very interesting. And can I ask you a further question of how have things changed since you've been using the core stroke skills training modules?
Okay, thank you very much for that question. Yeah, things have actually changed. I've been seeing great improvement from the way we were trained in handling patients, because the tools that we learned through the e-module, it was also helping some of the bedsiders when you go by the bed and just teach them on how to go about, especially the think aloud. Knowing that one of the greatest complications post-stroke, one is depression, and also incontinence. So it was through that we also had an intel and an in-depth on what we can tell our patients, and just include it in our health education prior discharge and as they were admitted as well. So I'm seeing great improvement because it was a tool that was made even for people who are not medical personnel. They actually learned a lot through that, and it's one of the tools that we're using for dissemination of information and to also cause awareness of stroke and how to handle such complications.
Lovely, that's excellent to hear. Farouk, what benefits does this training module offer to clinicians in low and middle income settings?
Yes, actually, I remember before we even went to Kolebu for this stroke training, traveling up and down was really stressful. But since the inception of these e-learning models, people don't have to travel far again to practice or to learn much about stroke. You can just sit at the comfort of your room, at the comfort of your hospital, at the comfort of your office, and learn much about stroke. So basically, since the inception of these e-models, people don't really come to rest to gain more knowledge on stroke care. They just sit at the comfort of their rooms, they learn, they get in touch with us. We teach them what they are supposed to know and add.
Thank you, Farouk. This is excellent to hear, and accessible stroke education is really our aim. So it's very encouraging to hear that people can just log in, as you said, from the comfort of their home and get all of the knowledge and skills that they need. Perhaps a question to Malango or Julius about the other side of the story. So how do you see these modules helping lay people and family caregivers where allied health professionals are scarce? Would you like to comment on that, Julius, Malango?
Thank you very much for that question. And yeah, I see this stroke module helping people that are not medical personnel, but those that are caring for patients, because through the way we actually did the module review and everything, it was always made as simple as possible that one can grasp the idea that is behind and what stroke is, what aspiration pneumonia is, if they see such signs and symptoms that can make them be alert and what they're supposed to do. So it's going to be a module that is going to help them know what is supposed to be done in terms of the positioning of the patient, and also avoiding giving patients foodstuffs before we did the swallow evaluation, because these modules were also able to tell us on the importance of, even if a patient is able to talk first, you have to bring them for swallowing evaluation, which is actually one of the greatest challenges that we've been having in our African setup. Because when they find you're trying to put maybe a nasogastric tube on a patient, they will think you're about to kill the patient. Also, when you're trying to put up maybe some oxygen nasoprons, they will think you're killing the patient. But through these modules, if we disseminate them to everyone out there, they'll be able to know this is a feeding option for the patients, and it's about helping them prevent the aspiration pneumonia. I have to position them like this to prevent decubitus ulcer formation. So it's like a voice for us, even when you don't have the voice to speak out to them. Thank you.
Excellent.
Thank you.
Julius has his hand up.
It's just a comment. Thank you very much. I must say that through this partnership, we were able to start a new stroke unit, which is functioning very well and has become a model in our region. You know, Volta region takes care of patients from other regions, both and even part of Togo. And then even we have patients coming from all the way from Nigeria, because we are close as the West African sub-region. And I think that this is the only dedicated stroke unit in this vast region. And it's a great deal and a great thing that Wessex Global came in to train us. And as I got the knowledge, I was able to go down with my colleagues and been able to train our colleagues, and the support from the UK team, Kolebu team. And it's so great that we have a well-functioning stroke unit today that is taking care of patients in Volta region. Thank you very much.
Thank you, Julius.
We are also the only hospital that is managing or that is having a dedicated stroke unit for stroke cases. So initially, for the past 2 to 3 years, leading cause of admissions in my facility, stroke was always the leading cause of admissions. Yes, but since the inception of this stroke unit, it has really done good to rest. Number of admissions, and most admissions came as a result of what? Reoccurrence of what? Stroke. But these days, ever since we started this training, ever since the inception of this unit, people get good education before they even get home. They take good care of their cases. We don't get relapse cases. So actually, the inception of the unit have really helped us. You wouldn't believe it. Last week or the last 2 weeks, we celebrated our week or World Stroke Day in another facility. We really have 3 big hospitals in Tamale, but we are the teaching hospitals, and we have 2 regional hospitals. So our week or our Stroke World Day was celebrated in one of the regional hospitals. We had to share our knowledge. We had to train them how to manage stroke cases. So it was really a fantastic job, and they were really happy. So the truth is that the stroke unit has really done a lot, not just to patients, but it has even helped our own families. We are now using the knowledge we acquired to also help our families, not just patients that are coming to the hospital.
Lucy, can I ask you what your hope for the future of the WGSP is?
Thank you. As we've heard, the modules have enabled access to basic core skills training for people in low resource settings without the need for lots of equipment or expensive intervention. And these core stroke skills do make a really significant difference to outcomes for people with stroke. We've got data from Ghana and from Zambia showing that in hospital mortality from stroke when we've started this type of training was at around 45%, which as compared to something like 12% in the UK. And after the training in the core skills modules, the mortality from stroke came down to around 20%. And we've got data in Ghana going back more than a decade showing that that's been maintained. So this is really important stuff. And our hope would be that actually the access to the modules will be disseminated really widely. We had our global launch of the e-modules via our website last week on World Stroke Day. So they can be accessed freely by anybody in the world via the website, which is wgstroke.org. And there's a link there. You have to create an account to have access to the modules, but there's no charge. And it takes you through the skills. And at the end, there's a quiz. We ask for a little bit of feedback, and then people get a certificate for their portfolio to show that they've done the online training. My dream, I think, over the next maybe 5 years or so would be to have reach into every English-speaking country in Africa and then hopefully beyond. So big dreams, but hopefully achievable.
Wonderful. So how can the World Stroke Organization and the World Stroke Academy support you going forward, Lucy?
We've already had fantastic support from the World Stroke Academy and World Stroke Organization because we've been able to do 2 webinars with you already, focused on partnership and the core skills. And I believe those webinars are still available on the WSA website for people if they want to see them. But really, in terms of future support, it's about promotion of access to the modules and awareness that this training is for free and it should be applicable to anybody providing care to somebody who's had a stroke. I've recently just returned from the World Stroke Congress in Barcelona, which was a fantastic networking experience. I've met loads of colleagues from all around the world. So hopefully through ongoing collaboration, we'll be able to widen our network and bring better stroke care to people throughout the world.
Thank you, Lucy. And you do make a good point. We're going to include all of the links to previous webinars, to the recordings, but also to these new e-learning modules in the notes of this episode. I want to thank everyone for your time and for your insights today. And we do look forward to helping you disseminate your work even further and support the next steps of the partnership. We heard today about how making high quality stroke education accessible is one of your goals, not only accessible, but also practical and relevant for clinicians everywhere. And that's at the heart of what the World Stroke Organization does as well. So your contributions are really essential to our mission. Thank you, everyone. And we look forward to seeing you in a next episode.
Thank you.
Thank you very much.
Thank you very much.
Thank you very much.
Thank you. That was great and wonderful to hear about, just all of the work and the impact it's having in your communities.